Hi YouTube, how are you doing? I had a great week since last week. As you can see, I've changed the colour of my hair. It's now very red. Also a little bit manky. I need to wash my hair later. But enough of that. On to the main topic. I really wanted to discuss with you ostomy supplies. I said in my last video that I was stupid and I hadn't ordered my supplies in time for me running out, so that was really stupid of me. But now I've got some supplies in, and because I think when you first get an ostomy you hear lots of different terms: 2-piece bags, 1-piece bags, convex bags, base plate, flanges, the actual bag, all the different accessories you can get. I think things are a little bit overwhelming and quite complicated to begin with, so I thought I'd go over the supplies that I use. I also have some examples of some other bags to show you. I think something, if you are about to have ostomy surgery, something to bear in mind is that when you wake up from your surgery, you'll have a bag on you already. The bag will more than likely be completely see-through, so the doctors and nurses can keep an eye on your outputs or the waste that's coming out. You'll find that it's very green when it comes out at first. Don't be put off by the fact it's coming out green. Don't be put off by the fact that you can actually see your stoma. It's completely normal to have a transparent bag to begin with, and you're not going to be, if you don't want to be, having a transparent bag for the rest of your life. So I think also, from what I remember, when you're in hospital, the first bag you have is called a 1-piece bag. So if I can show you an example, I've kind of got an example here of a 1-piece bag. It's basically where you have the bag and you have the part that attaches to your stomach, which is called the base plate or the flange, depending on who you're talking to. I'm sure there's about 10 other million terms for it, that sticks to your body. So this is completely attached. It doesn't come undone. So you'll probably be given these when you first have your surgery. You'll probably go home with these, at least in the UK and at least from the hospital I went to. But I personally don't like 1-pieces. I like to wear a 2-piece appliance. So if I show you that, also I should point out as well, this is open at the bottom. So you have open-ended bags and closed bags. So closed bags are where you don't have this opening at the bottom, you just have the bag, and I think that's more for colostomies, where the output you're coming through is a lot harder and you'd only be getting output like once a day or twice a day, so you'd actually change your entire bag when you have output. Whereas for an ileostomy, you're going to be emptying your bag a few times a day, so you're going to want something that you can drain your bag as the day goes on without having to change the entire thing, because one, it's very expensive for the NHS or for yourself. I don't know what the healthcare system is like in your country that you live in, but yeah, you don't want to be changing your bag every time you empty it if you have an ileostomy, for sure. So what I like to use is the 2-piece system. So that's where you have the bag. It's got a hole in the top, and that attaches to a base plate, which would look like one of these. Literally just clips on. That's not the one I use. I use the one like this, which I'll tell you about in a minute. And you literally, like, a lot of the different brands clip on differently, but clip it on and then it's attached, and you can take it off like so. So this is the base plate or the flange. Comes separately. Stick that to your body. Bag attaches on top. It's quite simple. The reason why I like the 2-piece is because I find that my base plate will last a good few days longer than the bag. The bag I'll either change once a day, or maybe 2 days in a row if I'm lucky, or how lazy I am. I don't really like to change the entire thing. Also, I find that if I am, say, let's actually do this up, look, because that's completely done up now. I find that if I'm in the office and my bag starts filling up with air, and it's just filling up with air, or if I'm in bed, this is probably going to sound really disgusting now, if I'm in bed and my bag fills up with a lot of air and I can't be bothered to go to the toilet, but I want to release the air, I just like to undo the top a little bit and let a little bit of the air out. But you can also get attachments that kind of go into the bag. That you just make a little hole, you put the attachment in it, and you can, it's like a little valve. It's quite cool, so you can let a bit of excess air out. I should also point that most ostomy bags also come with filters. So you can kind of see the filter here, it's like a charcoal filter. So air will come out naturally. It won't smell because they do have the charcoal filter in them. I just find that if you drink fizzy drink or you're having a large meal, I get quite a lot of air going into my bag all in one time. Too much for the filter to really cope with, so I just like to have that little ease of getting that out. So also I should say that bags come in lots of different sizes. You can see that this example of this one-piece bag I have here is a lot bigger than this one here. To be fair, I should probably do up the bottom of this as well. So again, it's just Velcro. Just does that, rolls up and does that. So this one is a lot bigger than this one. I always thought when I got my ostomy, I'd want a bag as small as possible. You know, less surface area. Find that this one would maybe hang down my leg a little bit too much because it's so big. But actually, there's pros and cons to having a large bag rather than a smaller bag. Smaller bag obviously holds less. So when it does fill up, it looks bigger than if you were wearing a larger bag. With this one, if it filled up, it wouldn't be so noticeable. You'd be able to go longer without having to empty it. Again, if you're lazy, having a Saturday lazy morning in bed like I do, and yeah, okay, enough of my personal habits. But yeah, so this is actually a medium-sized bag from Dansack, a company called Dansack, and these are the ones that I wear routinely. You can get smaller ones, you can get larger ones. I just find that medium size is a good compromise between being on the smaller side but yet not looking full too quickly. So this is the one I prefer. This one is from a company called Hollister, and this is also another feature that some ostomy bags have. As if I open this up, it's actually transparent underneath. So it's like a little peephole, so you can see kind of what's going on. I personally don't like it because sometimes you do get a bit of it looks like a brown line from where you can see your waist underneath. I don't think that's a very sexy look personally. Obviously some people would prefer to see what's going on underneath, see what's going on in their stoma, you know, making sure that their bag isn't about to, you know, how close they are to needing to change the bag. But I would rather go with a two-piece, a bag that you can't see anything. It's pretty, this is a little bit translucent, but it's really not very bad at all. I like it, otherwise I wouldn't wear it. So I think when you first get your ostomy, it's really a case of trying out lots of different brands, lots of different samples and seeing what you like. I know Convatec is a really popular brand, but the reason why I like the Dansack bags personally is because the hole that goes over your ostomy is quite high up on the bag. So if I was to put this over my ostomy, it goes quite low on my stomach. I don't like it riding up. This one here, you can kind of see the hole is quite low on the bag. So in comparison, this will come up a lot higher on my stomach than this one would. Also Dansack base plates. It's not one that I would actually wear. Let me get it out of the bag. So here you can see as well, the main hole where you have your ostomy is quite high up on your stomach compared to this one, which is a lot lower. I should also point out that, as you can see, my stoma is definitely not this big. It's a lot bigger than that. When you first have your surgery, it's going to take a while for your stoma to become the size that it's going to end up with. Again, it still can change though. If I put on weight, my stoma gets a little bit larger. If I lose weight, my stoma gets a little bit smaller in terms of circumference. So you'll be giving something similar to this, where you can measure out your hole of your stoma, your circumference. So I am at the moment about 30, but I think I'm coming down a bit smaller. So it's here. Obviously this would be like more of a colostomy, the larger one. A urostomy maybe for the smaller ones. But as time goes on, your ostomy will change size. So what they will do at the beginning is every time you get one of these base plates or your one piece, and you can see here where I started cutting one out. They do actually have measurements on them. So again, let me show you here. Don't know if you can see that. They've got the different sizes on. But what you can also do, if you know how large your ostomy is from your little template, you can draw yourself a little template, put it over the top, draw the hole, and you can get these scissors that are kind of bent, and they actually go around the circle really well. I'm quite lucky, my stoma's pretty much a perfect circle, so I can just get mine cut to a 30mm circumference now. I'm assuming that's circumference and not diameter. I think it may actually be diameter. Whatever it is, it's 30mm on it. And then I would just cut it here, so I would just cut it on the 30 line if I was to cut this myself. But because I get my ostomy supplies from a dedicated company, and my ostomy is a size where it's not changing size very often, unlike when you're just after your surgery, I get my company to cut mine for me. So you can see here, this is one that's been pre-cut for me. Perfect circle at 30mm. And if I wanted them to cut it at 28, they'd cut it at 28 for me. I think some companies also, if you had like more of an oval shaped stoma, kind of weird shaped stoma, you can send your template into them and they will cut your base plates or your one-piece bags into the size that you want them to be. So I should probably explain why this is the normal Dansack base plate, which goes with my usual bag, but I use this one rather than this, even though this is a lot smaller. It would be nice if I could wear this. I find that I leak quite quickly wearing one of these. It's quite thin. It's just my personal preference. So this is the one I use. I think it's called that Next 3. It's a lot larger, which isn't ideal, but it makes me feel more secure. It lasts a lot longer. The inside of this bag, you can't really see it very well, but it is really, really thick compared to, I can't find it out here, compared to this one. You probably won't be able to see that on here. But this is quite thin. This bit in the middle is about as thin as this bit on the outside, but in the middle it's really, really thick. So I find that it tends to last longer. I can often see it when it's about to leak. It kind of gets a bit translucent on the outside, and you may find a bit of air trying to escape out, so that's when I know it's time to change. But also, if you did want to wear a smaller one, you can get these some examples that I had, some extensions you could just stick over the top. So if you watched my last video, I was wearing a base plate that wasn't my usual, but it was from Dansack, so I could use my normal bags. And I was a little bit worried when I went out drinking that it may leak, so I did use some of these extensions around the outside just to give me a little bit extra security. I didn't need them in the end, but each their own. You may find you want to use them. So moving on to convexity then. So this one piece that I've been showing you is also a convex bag. This is a soft convex bag, and if you see from the side, it kind of sticks out a bit. I don't know if you can see that. So this is the usual one. It's completely flat. This one sticks out. So this is this type of bag, a convex bag, is usually used for people whose stoma is very small, may even go into the body a little bit, kind of flat against your surface of your skin. So when you put this bag against your body, the convexity bit will actually stick into your body and kind of push your stoma out a little bit more. So people that have stomas that are kind of close to the surface of the skin, maybe a little bit within the body of your skin, find they can leak quite a lot. When the output comes out their stoma, it doesn't tend to drop into the bag, it tends to go around the size of the bag, which isn't ideal. So these types of bags are great. You won't be able to get a convex bag without having prior permission to your stoma nurse, at least in the UK. But your stoma nurse will go over pros and cons of different bags. I actually had these because even though my stoma sticks out quite a long way, because I knew I was going to be having my ostomy permanently, I kind of said to my surgeon, please give me a stoma that is going to be good and not going to give me any issues. So my stoma actually comes out quite a long way. Maybe if I get the guts, pun intended, I'll show you my stoma at some point. if you want to see that, and you'll see that mine sticks out quite a long way. Because I was getting these leaking issues quite a lot, my stoma nurse suggested I try a Convex bag, which I did try for a while, but I prefer this really thick one personally. Each their own. This is why it'll take a while for you when you first have your surgery to find a system that works for you and is gonna work for you, a bag that works for you. I've tried some bags before that literally wouldn't stick to my body and they'd fall off overnight. That's not the brand for me, obviously. But ironically, Dansac were the ones that I got given at first, only the one-piece bags with these smaller ones. And I just find that any other bag is just too high up. I just don't like it. So I'm really glad that Dansac have got these thicker ones. That means that my base plates last a good few days and I don't really have too many leaking problems. And as you can see, they're quite bendy, so they'll fit around onto your stomach. So yeah, so that's pretty much it for bags. The accessories I use, obviously you're going to need some wipes to wipe yourself up, wash yourself with some warm water to get rid of anything on your skin when you change your bags. A must. Most providers that supply bags, at least in the UK, will give you these for free, and they'll also give you these bags. They look like my friend's dog walking bags, which is lovely. But yeah, stick everything in there, do it up, throw it in the bin. I also used to use like a spray, an adhesive remover spray to get my ostomy bags off my skin, because sometimes it can be a bit painful to pull that. But I don't actually use a spray anymore. I've got some wipes and I did bring them in here, but I don't know what I've done with them now. So I basically just use a wipe. So it's just like a little, a bit like the KFC like wipes that you wipe your hands with, but obviously not the same thing because it's an adhesive remover. You just undo it, wipe it around your ostomy, and it gets rid of any other residue that's on your skin. Or if you're pulling your bag off your skin, you can just wipe it down, it'll help it to come off. But I just pull mine off, I don't even care anymore. The only real other accessories that I use is I've got these little sachets that can go into your bag, and it can help your bag when your output's really liquidy. It can help really firm things up. I don't use them very often. I've said before that I like to use a lot of loperamide or Imodium to try and thicken things up. But if I'm finding that I've taken quite a lot or it just hasn't had time to work, if I stick one of the little sachets in my bag, then it really works really well. Also helps with odour issues. In terms of odour, I've got these little Osto mint drops, which I'll probably show at some point, and I just drop a couple in the end of my bag. So if my bag's on, I'll just open up the end where everything comes out, drop a few in. I do them in kind of mint, not tangerine, vanilla. My favourite is probably the tangerine, second mint. And again, when you're emptying your bag, it doesn't smell as bad. So win-win. So I think that's pretty much it for my little tutorial there on ostomy bags, different types of bags, try and get your head around what everything is. But if you've got any questions, as always, just feel free to drop me a line, I'll let you know. As I said before, there's loads of different brands out there, loads of different types of bags. What suits one person isn't going to suit another. There's also a lot of different other accessories you can use if you're having problems with leaking or anything else. I'm quite lucky, I really don't have too much of a problem now. I found a bag system that works for me. But maybe I'll go over that in another video, or alternatively there are loads of videos out there. I know there's quite a few ostomates who do reviews on different accessories for ostomates. So feel free to go and check those out as well. And in the meantime, I hope you all have a great week, and I'll catch you in the next one.